Today we're going to talk about Chapter 15, Nervous System Diseases and Disorders. This is the class, the pathology class, Pathophysiology. First, let's start talking about the anatomy and physiology of the nervous system. You have a brain. You have a brain, spinal cord, and nerves that form the nervous system. The nervous system is divided in two different parts that are the central nervous system that is formed by the brain and the spinal cord, and the peripheral nervous system that is the autonomic nervous system and is formed by the cranial and spinal nerves. Common signs and symptoms of diseases and disorders of the nervous system are headache, nausea, and vomiting. Not necessarily if you have a headache and nausea and vomiting is a problem in the nervous system, but can be related. Weakness, mood swings, and fever. Now let's talk about symptoms that are specific to the central nervous system. If you have stiffness in the neck, back, or extremities, inability to move any part of the body, seizures or convulsions, paralysis, and visual difficulties. Symptoms specific to the central nervous system, a continuation of these symptoms: inability to speak, paralysis again, extreme or prolonged drowsiness, stupor or unconsciousness too, amnesia or extreme forgetfulness. There are some diagnostic tests that help in revealing if the patient have any nervous system disease or disorder, like the cerebrospinal fluid test, measurement of intracranial pressure, X-rays of skull and vertebral column, the myelogram, angiogram, electroencephalography, EEG, and CT scan and MRI. Infectious diseases related to the nervous system are, let's talk about the encephalitis. Encephalitis is an inflammation of the brain tissue caused by a bacteria and viruses. The symptoms are headache, elevated temperature, stiff neck and back, lethargy, mental confusion, coma, and the treatment for this type of disease is a supportive treatment to control the symptoms, and also antiviral medication may be effective too. Another disease is meningitis, that is an inflammation of the meninges or covering of the brain and spinal cord. The causes of this infection or an inflammation is bacteria, viruses, fungi, toxins, for example, lead, arsenic. Meningitis is inflammation of the meninges, the covering of the brain and spinal cord. In the etiology of this disease, meningitis can be caused by anything that causes an inflammatory response, as we mentioned before, including bacteria, viruses, fungi, toxins, such as lead and arsenic. Some forms of meningitis are more contagious and more lethal than other forms of the disease. This type of patient that suffer of meningitis, sometimes they have to be in the intensive care unit because if the disease is very acute. The most common cause of meningitis is bacterial invasion by Neisseria meningitis, or Neisseria meningitidis. These bacteria and viruses usually reach the meninges after invading and infecting other parts of the body, such as the middle ear, sinuses, and upper respiratory tract, or they can be carried to the meninges in the blood, as in septicemia. The symptoms of meningitis include high fever, severe headaches, photophobia, that is, feeling uncomfortable with too much light, or even with a little light, stiffness and resistance in neck, nuchal rigidity, drowsiness, stupor, seizures, and coma. For the diagnosis, the lumbar puncture is used to find causative agent, what type of bacteria is causing the problem. For the treatment, antibiotics for bacterial infection. So, you can use antipyretics, anticonvulsants, and quiet, dark environment because of the photophobia. Another disease related to the nervous system is poliomyelitis. Poliomyelitis is a viral infection affecting brain and spinal cord. The cause is a virus spread by oropharyngeal secretions and infected feces. Almost eliminated by vaccine in the United States, but polio was a major crippling and life-threatening disease affecting children prior to the development of a vaccine in the 1950s. Immunization programs since that time have virtually eliminated the disease in the United States. The poliomyelitis virus enters the body through the mouth and nose. It crosses the gastrointestinal tract into the blood and then travels to the brain and spinal cord. The virus is spread by oropharyngeal secretions and by infected feces. The symptoms: muscle weakness. For polio, we're talking about poliomyelitis. The symptoms are muscle weakness, neck stiffness, nausea and vomiting, muscle atrophy, and become paralyzed. This is the main characteristic: muscles atrophy and becoming paralyzed. So that's why poliomyelitis is a disease that is important to study and to be vaccinated against polio. For the diagnosis, you can do a virus culture from throat, feces, and or spinal fluid. The treatment, so you can have supporting treatment like analgesics, bed rest during acute phase. Long-term physical therapy and braces may be needed. If respiratory system involved, mechanical ventilation may be needed too. Now let's talk about tetanus. It's a highly fatal infection of the nerve tissue. It's caused by the bacteria Clostridium tetani. The first symptom is jaw stiffness, commonly called lockjaw. The effects of the toxin produced by the bacterium of the central nervous system lead to voluntary or skeletal muscle contraction. The first symptom is typically a stiffness of the jaw, commonly called lockjaw, and is due to a strong jaw muscle contraction. This disease affects both the musculoskeletal system and the nervous system. More detailed information about tetanus is found in Chapter 6, Musculoskeletal System Diseases and Disorders. Now let's talk about rabies. Rabies is an often fatal encephalomyelitis. It's caused by a virus, primarily affect animals, example dog, cats, raccoons, squirrels. I remember a cartoon that was a squirrel. I want to remember the name. Transmitted to humans through bite of infected animals. So rabies is like tetanus. This virus, rabies, travels slowly to the spinal cord and brain. So the location of the bite is significant, is important. Incubation time is from 1 to 3 months. The shorter incubation times are related to the position of the bite, making bites to the face and neck more serious than those to the extremities. The symptoms of rabies are fever, pain, paralysis, convulsions, rage, spasm, and paralysis of muscle for swallowing. Those are the main characteristics to differentiate it. Rage and spasm and paralysis of muscle for swallowing, throat spasm leading to hydrophobia. So you get scared of the water. You cannot drink water. More symptoms of rabies are inability to swallow, again, drooling of frothy saliva. For the treatment, immediate washing of the area with soap and water of the area of the bite. Anti-rabies injection. There is no cure for this disease. So the treatment of the rabies include immediate washing of the area with soap and water, followed by medical attention. A series of anti-rabies injections must be given before the virus has had time to reach the brain. Any animal bite needs to be investigated immediately. The biting animal should be confined and placed under observation for symptoms of rabies, and viral culture should be obtained. If the animal cannot be captured and must be killed, care should be taken not to destroy the head, because the brain must be examined for presence of disease. If the animal cannot be found, the injured individual will need to take the series of injections immediately. There is no cure for rabies again. Treatment is palliative and include strong muscle relaxants to reduce convulsions. Untreated cases end with severe convulsions and respiratory arrest. Death usually occurs within 2 to 5 days after onset of symptoms. For prevention of the rabies, prevention begins with vaccination of family pets and education of children in recognizing or avoiding animals with rabies symptoms. Now let's talk about shingles. Shingles is a viral disease caused by herpes zoster, chickenpox virus. The symptoms include itchy, painful, red rash, and small vesicles or on sensory nerve paths. The symptoms last 10 days to several weeks. The diagnosis is made based on the appearance of the lesions and also with a viral culture test. Shingles is an acute viral disease. Again, approximately 1 in 3 people will develop shingles in their lifetime. It is more common as people get older, with 50% of cases developing in men and women over age of 60. In the etiology, again, the shingles is caused by herpes zoster, the same virus that causes chickenpox. The only difference between chickenpox and shingles is the level of the affected individual's immunity. Chickenpox usually appears in children with little or no immunity, and shingles occur in adults with limited immunity. It is thought that herpes zoster virus is a chickenpox virus that has been dormant, usually for years, after recovery from chickenpox. This virus tends to flare up or become active during periods of stress or immunosuppression caused by other disease processes, trauma, and aging. Again, in the symptoms, shingles is characterized by an itching, painful red rash and small vesicles or blister that follow the course of a sensory nerve. The resulting neuritis or inflammation of the nerve results in a stabbing, sharp pain that usually is more severe at night. Symptoms can last again from 10 days to several weeks. The pattern of rash and blister usually appears on the body, trunk, and runs toward the middle, but also can appear on the face, causing severe conjunctivitis. A rarer form of shingles is zoster sans herpes, or shingle without the typical rash. Pain may run more front to back and is often mistaken for a heart attack. Shingle vesicles follow a nerve path. The diagnosis, again, is made of the basis of the appearance of the lesions. For the treatment, this is the shingle lesions. Here you can see how they follow a nerve path. There is a nerve, there are nerves coming in this path of the body. For the treatment, again, there is no cure for shingles. The treatment is symptomatic and involves antivirals, analgesic, antipyretics, antipruritics. For example, antiviral medication, we can mention acyclovir, valacyclovir, famciclovir. Analgesics like acetaminophen, aspirin, ibuprofen, and opioids like codeine for severe pain. Topical antibiotics applied to prevent infection of the open blisters, and antipruritics, medications to reduce itching. For prevention, Zostavax is a vaccine to prevent shingles, recommended by the CDC for adults over 60, and has been available for individuals over 60, was licensed by the Food and Drug Administration, FDA, in 2006. People who have had shingles can still receive the vaccine to help prevent further outbreaks. The vaccine is not a treatment for shingles, it's for prevention. Now let's talk about vascular disorders related to the nervous system. First, let's talk about cerebrovascular accident. Cerebrovascular accident is also known as stroke or brain stroke. Is due to a poor blood supply to the brain. The causes are a cerebral thrombus, a cerebral embolism, or a cerebral hemorrhage. When they say thrombus or embolism, it's kind of the same thing because it's a blockage in the irrigation of the blood that enters to the brain. There is an artery that is blocked by a thrombus or embolia, and the other option is the hemorrhage. That is when an artery of the brain is broken, maybe because of high blood pressure, and the wall of the artery was weak or had an aneurysm in the artery, and there is a breaking in this artery, and then you have hemorrhage. This type of cerebral stroke is deadly. Most of the patients die with cerebral hemorrhage, but the embolism, there is way like to treat the patient. The patients get some sequels like get one side of the body paralyzed. For example, if the arteria that is blocked is in the right side of the brain, the left side of the body gets paralyzed. Like the mouth, you can see a deviation of the mouth. The mouth is not moving from one side, and the arm either, maybe even the leg. Cerebrovascular accident or cerebral infarction or a stroke, cerebral stroke. The symptoms of this disease, you have numerous symptoms depending on the area of the brain affected and the severity of the cerebral vascular accident or cerebral stroke or cerebral infarction. For example, you have a patient that shows a sudden loss of consciousness, confusion, poor coordination, dysphagia, and hemiparesis. When we say hemiparesis, we are talking about as one side of the body is paralyzed. Dysphagia is impossibility to eat. Dysphagia is impossibility to talk. Now, continuing with vascular disorders of the nervous system and continuing with cerebral vascular accidents, the diagnosis of this disease is a physical examination to determine, like, to check the patient. Just seeing the patient, examining the patient, you can get to the diagnosis. And you can also help yourself with electroencephalogram, CT scan of the brain, and MRI of the brain. The treatment for this disease is anticoagulant, hypertensive medication, rehabilitation program. The risk factors are smoking, high-fat diet, obesity, lack of exercise, and also age. Surgical prevention treatment, you can have a carotid endarterectomy. That's a surgery from the carotid, like to try to unblock the embolus or the plaque of cholesterol that is blocking the artery in the brain. So the cerebrovascular accident is commonly called a stroke. Again, for Americans, it is the fifth leading cause of death and the leading cause of serious long-term disability. The cerebrovascular accident is due to poor blood supply to the brain. A common causative factor is arteriosclerosis. As cerebral vascular accident is to the brain what a heart attack is to the heart. Lack of blood flow to the brain causes brain tissue death. The three common causes of poor blood supply or lack of blood flow are, as I mentioned before, cerebral thrombus, cerebral embolism, and cerebral hemorrhage. Cerebral thrombus is a clot in the brain artery and the most common cause of vessel occlusion. The thrombus formation usually occurs in an area where the vessel is narrowed by arteriosclerosis. The symptoms usually appear gradually until the blood flow is inadequate. Now, cerebral embolism is usually due to a small piece of a thrombus or arterial plaque breaking loose and traveling in the artery until it wedges and occludes the vessel. Symptoms usually appear quite suddenly. So one reason is cerebral thrombus, that is a clot, and the other is a clot of blood, right? And the other cause is cerebral embolism, that is caused because of a small plaque of cholesterol. This small plaque of cholesterol can travel from the veins in your legs. A small plaque travels through all these veins in the body, comes up, and because the veins of the brain are so small, so tiny, they get blocked with this piece of plaque of cholesterol that is traveling in the body from the legs. The other option is cerebral hemorrhage, that is the rupture of an artery filling the surrounding brain tissue with blood. Cerebral hemorrhage is usually due to hypertension and arteriosclerosis, which cause the vessel to tear and hemorrhage. Another cause of the cerebral hemorrhage is a weakened artery due to an aneurysm. Symptoms are very sudden with hemorrhage. The symptoms: when an area of the brain loses blood supply, the individual suddenly loses consciousness and can die. or have permanent neurologic disability. About 1/3 of individuals with cerebral vascular accident die. Some survive without functional disability, and others might have mild, moderate, or severe disability. The symptoms of cerebral vascular accident are numerous, depending on the area of the brain affected and the severity of the occlusion of the hemorrhage. Common symptoms again are dysphasia, that is difficulty speaking, dysphagia, that is difficulty swallowing, hemiparesis, that is one-half paralysis of the body, confusion, and poor coordination. There is another vascular disorder related to the nervous system that is called TIAS, TIAS, that is transient ischemic attack or transitory ischemic attacks. This is the same situation of the cerebral vascular accident, but it's just happens for a few minutes or for a few hours. Is that one vessel is blocked by a thrombus or a plaque of cholesterol, but by itself the blood torrent is able to push and to unblock the blockage, and the damage is not severe and it's just transitory. Maybe you see a person with this transitory ischemic attack, and you see the person that I was able to see a patient with this type of attacks. Emanuela Pierre, I see you here. I will make sure you're present. So,
okay, thank you.
I was able to witness a patient with this type of disorder. It was a patient that I was talking to in a hospital in Dominican Republic, in a consultation room. We were doing like a regular consultation for neurology, the neurology department. I was just an intern, a medical intern. And this person started talking. She was talking fine, like everything logical. What's your name? She said the name, she said the age. But then she started talking like she was talking Spanish, but she started talking like you couldn't not understand her. Like you can think she was talking in Japanese or I don't know what language, in a language that I couldn't like imagine what it is, because she just had this patient just was having right there a transitory ischemic attack. So she was talking something like it's not to make fun of the patient, but I'm gonna tell you one phrase that showed me an uncle of mine that we never knew in the family, like where he got this phrase from, but it's kind of a joke. He told us like, if you repeat this phrase, I will give you $100. The phrase was like this. Listen to this. And tell me what language is this. Abut Karim Kasen Gama Abel Nasser Reza Falevi Ungay Mungay Chukuluka Chong. So this is it was something like this that the person was saying, because it was something like something that was kind of crazy, that nobody could understand what she was saying. So the thing is that she was having a transitory ischemic attack. Whatever she was saying, she didn't have coordination of the letters and the words. But after a while, like after we had her in observation, the patient, like for 2 hours in the consultation room, and after like 30 minutes, she was back again, talking normally and coordinating everything. So we didn't have like to intervene her, like send her to intensive care or something like that. The patient got back again fine. So the transient ischemic attacks, or TS, also known as mini strokes, are due to insufficient blood supply to the brain. The symptoms are weakness of arm or leg, dizziness, slurred speech, mild loss of consciousness. The symptoms last a few minutes to 1 hour. The diagnosis is by angiogram. The treatment is surgery to improve the blood flow, or the patients can get better by themselves in a few minutes to 1 hour. Some functional disorders. Some functional disorders of the nervous system are degenerative disc disease, headaches, epilepsy, Bell's palsy, Parkinson's disease. There are also some functional disorders like degenerative disc disease. Well, we're seeing this in detail. Degenerative disc disease. Well, we have less than 1 minute. Let's join the Zoom meeting back for maybe 5 more minutes, 5 or 10 more minutes. Because we have less than 1 minute, okay? Please join the Zoom meeting back again. The last slide is functional disorders.